What is acute cholecystitis? Acute cholecystitis is the sudden inflammation of the gallbladder, typically caused by a blockage of the cystic duct by gallstones. This blockage leads to bile accumulation, irritation, and inflammation of the gallbladder. If untreated, it can result in serious complications like infection, gallbladder rupture, or peritonitis. Causes of acute cholecystitis. Gallstones, most common cause, stones block the cystic duct, preventing bile flow. Acalculous cholecystitis. Inflammation without gallstones, often associated with severe illness or trauma. Infections. Bacterial infections like Escherichia coli or Klebsiella. Bile stasis. Prolonged bile stagnation in critically ill patients. Symptoms of acute cholecystitis. Severe pain. Sudden, sharp pain in the upper right abdomen, often radiating to the right shoulder or back. Nausea and vomiting. Common accompanying symptoms. Fever and chills. Signs of infection. Tenderness. Pain and tenderness when the abdomen is pressed, Murphy's sign. Jaundice. Yellowing of the skin and eyes, in cases of bile duct obstruction. Complications of untreated acute cholecystitis. Gangrene or perforation of the gallbladder, may lead to life-threatening infection. Abscess formation. Localized pus collection around the gallbladder. Cholangitis. Infection of the bile ducts. Peritonitis. Infection spreading to the abdominal cavity. Diagnosis. Clinical examination. Murphy's sign. Pain on pressing the gallbladder area during deep breathing. Ultrasound. First-line imaging test to confirm gallstones, gallbladder wall thickening, and bile duct obstruction. Blood tests. Elevated white blood cells, liver enzymes, and C-reactive protein indicating inflammation or infection. CT scan or MRI, to assess complications like abscess or perforation. Treatment options. Initial medical management. Fasting to rest the digestive system. Intravenous, IV, fluids and antibiotics to control infection. Pain relief with appropriate medications. Surgical treatment, definitive. Laparoscopic cholecystectomy, minimally invasive removal of the gallbladder, the gold standard for treatment. Open cholecystectomy, required in complicated cases or when minimally invasive surgery isn't feasible. Percutaneous cholecystostomy. Temporary drainage of the gallbladder for high-risk surgical patients. Prevention tips. Maintain a healthy diet with reduced fat intake. Stay active and maintain a healthy weight. Avoid rapid weight loss, as it increases gallstone risk. Why choose Professor Zahid Mahmood for treatment? With over 30 years of surgical expertise, Professor Zahid Mahmood is a leading general and laparoscopic surgeon at Hameed Latif Hospital and Gurki Teaching Hospital, Lahore. He specializes in the management of gallbladder diseases, including acute cholecystitis, offering minimally invasive procedures for faster recovery and better outcomes. Contact 0300 4130 159. Hameed Latif Hospital, 6 p.m. to 8 p.m., Monday to Saturday. Gurki Teaching Hospital, 9 a.m. to 1 p.m., Mon, Wed, Fry. Don't let acute cholecystitis escalate. Consult Professor Zahid Mahmood today for expert care and lasting relief.